Hello and welcome. Today we're diving into a congenital heart defect called anomalous pulmonary venous connection, or APVC. This condition affects how blood flows from the lungs back to the heart. Let's explore its causes, effects, and how it's managed. The exact cause of APVC is often unknown, but it's a birth defect, meaning it develops during fetal development. Typically, the pulmonary veins, which carry oxygen-rich blood from the lungs, connect directly to the left atrium of the heart. In APVC, these veins connect to the heart in the wrong place, usually to the right atrium or one of the veins leading to it. This abnormal connection disrupts the normal flow of oxygenated blood. Now, let's understand the pathophysiology. In APVC, oxygenated blood from the lungs flows into the right atrium instead of the left. This means that the right atrium receives both oxygenated blood from the pulmonary veins and deoxygenated blood from the body. This mixed blood then flows into the right ventricle and is pumped to the lungs. However, some of this oxygenated blood recirculates through the lungs, while the rest mixes with deoxygenated blood in the right atrium and proceeds to the body. The amount of oxygenated blood reaching the body is reduced, leading to cyanosis, or a bluish tint to the skin, and potentially other complications. APVC is a relatively rare condition, accounting for about 1% of all congenital heart defects. It's estimated to occur in approximately 1 in 10,000 live births. There's no known gender or ethnic predisposition to APVC. The signs and symptoms of APVC vary depending on the severity of the condition. Some infants with mild APVC may have no symptoms, while others with more severe forms can experience significant problems. Common signs and symptoms include cyanosis, shortness of breath, fatigue, poor feeding, and frequent respiratory infections. In severe cases, it can lead to pulmonary hypertension and heart failure. Diagnosing APVC typically involves a combination of physical examination and diagnostic testing. A doctor may suspect APVC based on the presence of cyanosis or other signs of heart problems. Tests that can help confirm the diagnosis include echocardiography, which uses sound waves to create images of the heart, cardiac catheterization, a more invasive procedure that allows doctors to measure pressures and oxygen levels within the heart, and cardiac MRI or CT scan, which provide detailed images of the heart and blood vessels. APVC can be classified into different types based on where the pulmonary veins connect. The most common classification is based on the Darling classification of 1941 supracardiac, which connects to a vein above the heart, like the superior vena cava; cardiac, which connects directly to the right atrium or coronary sinus; infracardiac, which connects to a vein below the heart, often the portal vein or hepatic veins; and mixed, which involves multiple connections at different levels. The primary treatment for APVC is surgical repair. The goal of surgery is to redirect the pulmonary veins to the left atrium, restoring normal blood flow. The specific surgical approach depends on the type of APVC. In some cases, catheter-based interventions may be possible, but surgery is usually necessary. Medications may be used to manage symptoms such as heart failure or pulmonary hypertension before or after surgery. Currently, there's no known way to prevent APVC, as it is a congenital heart defect arising during fetal development. Genetic counseling may be offered to families with a history of congenital heart defects. The prognosis for individuals with APVC depends on the severity of the condition and the success of treatment. With early diagnosis and surgical repair, most infants with APVC can live relatively normal lives. However, long-term follow-up is essential to monitor for potential complications such as pulmonary hypertension or arrhythmias. Research continues to advance our understanding of APVC and improve treatment outcomes, including exploring less invasive surgical techniques and strategies to prevent long-term complications. Gene therapy also is an area of interest.